Good morning, everyone. This is Mary Funseth. I'm with Superior Health Quality Alliance, and I would like to welcome you all to our event today. It will be an open forum to discuss a number of questions, but please feel free to chat in additional questions today and or ask additional questions or share additional information if it's not a question we have listed on our screen. I would also like to draw your attention to the fact that we have another upcoming event coming Thursday on August 27th, 9 a.m. Central and 10 a.m. Eastern, where we will be having Novo Nordisk come, Tom George, representative, coming to talk with us about cardiovascular disease and diabetes around the area of COVID-19. I also want to remind you there will not be a call next Thursday, August 20th. We will be having an evaluation again posted in our chat. We really appreciate it when you let us know how we are doing and providing any other information that we ask as far as additional suggestions for us. Next slide. Thank you. So for most of you, I think you've been coming on a regular basis, but some of you may be new to us today. We are Superior Health Quality Alliance, and we formed in 2018, and we brought together 8 healthcare organizations from across 6 states. We are the 3 QIOs, the Quality Improvement Organizations that most of you know for many years, from Minnesota, Michigan, and Wisconsin. We are now joined by the hospice associations from Minnesota, Michigan, Wisconsin, and Illinois, and further joined by the Midwest Kidney Network. Altogether, we have been assigned to work on CMS quality strategy goals, and our goal is to improve the quality of health and healthcare for consumers, patients, clinicians, organizations, and communities we serve. We're going to be doing this across 2 particular areas, focusing in nursing homes with the goals, as well as the same goals will be focused on in community coalitions. Together, nursing homes and community coalitions will work on the goals simultaneously. There will be some different types of assignments at times for nursing homes, but again, we will come together as one team of healthcare. So when we get started with our coalitions and working with our nursing homes, we're going to be asking our folks who come along with us to take an assessment. The assessment will be brief, it will be virtual, and it will be something that you will know the answers to. And what it will do is simply help guide you to where your successes are and where your gaps are. It will also further help you decide how would you like to participate. We have developed 3 specific approaches. One being independent implementation of working on your initiatives and goals around the aims that we have put forth. And you will be able to have great access to the resources that we can provide to you. We are also creating affinity groups. And again, designed to be virtual. This is a way for you to connect and network and study with others. And it will be laid back and easy to access, and it won't be a time-consuming venture for you to go with a group. We also are going to have structured collaboratives. These will be small groups, again, learning together, but much more of an intensive approach. Specific experts will be consistently in the room with you, and you will go through various practices and assignments and to work towards goals. Again, these are all something that you get to choose from. So this is a complementary of approaches that you will decide what is best for you at any given time, and you can go in and out of them also at any given time as you work with us across the initiative. Next slide, please. As always, our sessions are recorded. You can go out to our website and find the recordings for previous events like this. Today, as always, we ask you to mute yourself, but only when you're not speaking. Remember, today we do want to have a lively conversation. We do not have a specific speaker. So we would like you to consider having your hand ready to unmute yourself so you can share. As you can see here, you can either unmute yourself by using the button on the screen, but if you've called in, you need to press *6 to unmute. We want to make sure that you're not disclosing any personal health information. If you're having any sort of trouble at all with Zoom or anything regarding this visit today, please chat it in to Jessica Newsom. She will help you. If you have any other questions or comments, again, please feel free to chat them directly to us or to the entire group. Next slide, please. So here we have, if you are joining via phone and didn't get a participant ID, please link your phone line to your web presence via these following steps. We'll also see if you can put this in the chat as well, Jessica? Possibly not, because it is a slide. But we'll give you a moment to take a look at this. Okay, let's move to the next slide. We are also hoping that you'll today use a camera. It's nice to see your face when you're talking. It's not mandatory, but we sure enjoy having an opportunity to see you in person. Next slide. So today, as I mentioned, we are going to be talking around a particular area that we feel that you are the experts, and you may also have some ideas about what sort of policies that will help support your staff. So we're hoping that today that you could share with us what policies that you do have in place that you use to ask staff to refrain from activities known to cause the spread of COVID-19. As you know, contact tracing has shared, that some of the reasons why COVID-19 is spreading is because of group events. Your dedicated staff is coming to work every day, getting their, temperatures taken, having questions asked of them. They're wearing masks, but then yet they do go home to their own lives. So anyone is welcome to open this up to give us an answer, but we also can take a look at the chat if you feel more comfortable providing an answer there. And again, *6 to open your line if you're on the phone. Otherwise, you can unmute yourself.
Good morning, everyone. I'll kind of start us off if that's okay. I'm Sarah Jordan with ABF Home Health. And
thank you, Sarah.
You're welcome. Good morning to all of you. I think this is kind of a twofold question, because certainly as employers and employees, we can't control what people do outside of the workplace. So all we can do is put those policies in place that hopefully keep us all conscientious and safe, and we make recommendations. And from there, we just hope that everybody takes this seriously enough to practice those things that keep us all and our families safe. So, of course, we have, since we're all in the healthcare industry and many of us are faced with patients who are sick, it's important, of course, that we follow all the hygiene practices inside of work and outside of work in your own homes as much as possible. Especially if you have young children, teaching the children how to, stay safe and practice hand washing and all of that. But I think on a larger scale, the most important thing is, and hopefully you guys have already all done this, is to have those practices in place that state if you are taking a family vacation or going camping for the weekend, things like that, and that there is COVID outbreak in that area, or you've heard of something, that you do In fact, we ask you to quarantine for 2 weeks upon returning home and to continue to report daily with your temperatures and any signs and symptoms. Of course, we're all reporting every day, weekends, holidays, all of that. But the thing is really just to have those basic procedures in place that state, hey, listen, I went on vacation. We don't know of any COVID cases, but we're going to quarantine. Sometimes they're just doing that as a general practice. And other times, if you know you're in a heavily populated area, like let's say you took your family to Florida, which we know right now is a state that's of great concern, that you do quarantine for 14 days before returning to the office. You can work from home, things like that. So I think that's the key, is to just help everybody understand the importance of this.
Thank you, Sarah. I have a question for you. So if you have staff openly saying, I will be taking vacation, they probably ask to take off, so you grant that time for them to take off. Do you then build the time off to include that 14 days post-vacation? So for example, if a staff member would say, I'm going for a week to Florida, then would you say, okay, you need to take 3 weeks off?
No.
Okay.
We just don't let them come back into the office. So they'll work remotely for 14 days before returning to the workplace, if
Okay.
they're even required to work in the office. So like we just had someone come back. She came back, let's say last week, and so she's not going to come into the office for her regular scheduled days until after that 14-day period. But she's still working.
Okay, thank you. And are all of your staff for your company in an office and or work remotely, or can work remotely to do their work?
Well, we have a rotating schedule, and so we have a smaller office, and
Okay.
we've positioned everything where we're all 6 feet apart. Some of us are in separate rooms, but so that would mean like this week I work 3 days in the office, 2 days from home, and then the next week I work 2 days from home, 3 days in the office. So we're always here with the same 3 or 4 people, and we're always 6 feet apart, and we're of course doing the hand sanitizers in and out, face masks until you get into the office, all of the normal precautions, but we're not all together as one team. However, of course, we can communicate via Zoom or however,
Yeah.
but everyone does have days where they are working remotely, and that's for the office staff. Of course, the nursing staff, since we're home health, is a little bit different.
Sure. Can you speak to the nursing staff that goes out?
We do speak to them regularly, yes. Our clinical director is over all of that, and she is very closely following details. We have a stream of Tiger texts that go out pretty much every day to update if there's any changes, if there's anything they need to know, reminders, safety posts. So there is communication every day. There are also regular scheduled meetings once or twice a month.
And is the same policy for those folks who are going out into the field the same as what you had already spoke about for the folks in the office?
Yes, it is very similar. Of course, the clinical staff does have, they have to follow PPE procedures, and they have additional things that they must do as clinicians, and certainly going into homes where we don't know who they've been exposed to in the home. So everyone is still wearing full PPE. Everyone is still following. We just went through a CHAP survey, so we passed all of those requirements. And we're just asking everyone to adhere to the policies to keep us safe. It's so important not only to keep our staff safe, but to keep the communities that we serve safe. And if you look at the news, you can see there's still a lot of things happening, a lot of outbreaks that possibly could have been prevented had we been a little bit more cautious.
Yep. Thank you, Sarah, for sharing. Does anyone else have some follow-up questions for Sarah Jordan?
This is Cheryl, and I don't have any questions, but I think the big thing that we've talked about throughout rural Wisconsin and all of our members is we need to set the example. Everyone, when we set the example and you go out in public everywhere, that's where it's going to start, and not to like say, oh yeah, we have to do this, really give a general, yeah, I'm protecting myself, I'm protecting my family, and just leave it at that, and just set the example.
Mm-hmm. Thank you, Cheryl. Jessica, why don't we go to the next slide, but everyone still keep in mind, if you have some more to say about policies, we certainly will talk about it. Another part of our question today is, and we're somewhat already starting to address that, is are you educating your staff about refraining from activities that are known to cause the spread of COVID-19? We've already alluded to that. Perhaps tell us a little bit about some of the barriers to this, whereas you have staff possibly rebutting what you're asking them to do, or not to do, I should say. And if you're having any problems such as that with your staff.
I'll jump in again if that's okay.
Certainly, Sarah.
I don't want to dominate the whole conversation, but I think that's something that hopefully our teams that we've employed and the people that we work with are already conscientious enough, but there are always those few that kind of don't believe that COVID is as severe. I mean, if you look at the governor in the state of Michigan, all the protests that went on and things like that, all we can really do is caution them. If it's something that's very rebellious, like they're saying, I refuse to do that, I don't believe this, then, you may have to take it a step further, but you still have to adhere to the HR guidelines and all of the policies that are in place that are so important, because this is a free country. They are an at-will employee.
Yes.
I don't know the HR laws, but somebody in the organization does. So if you run into those types of situations, I would recommend that if you have an HR team, you consult with them. If you're small and you don't have an HR team, then maybe speak to your legal team about how to handle that without, crossing barriers, and take it from there. There are going to be those that refrain, but if they say they don't care and they're out just doing what they normally did, which I think is very difficult to do since there's a mask law now and the things that the governor has put in place, but there are going to be those people. So we just have to treat them individually. We have to talk with them, and we have to make them understand, especially in healthcare, like you said, we have to set an example, and there is not an option for this.
Yes, thank you. Anyone else in regards to that, or any other questions for members of the Superior team or anyone else?
This is Roxanne, and I'm from Lutheran Social Service in Minnesota, and we had a number of
Roxanne.
people. Hi, good morning. Cheryl and others, this has been a great entrance into some of this conversation. We had a number of protests going on here in Minneapolis, and we had a number of employees that we wanted to support in terms of wanting to really represent their voice. And so we had two dynamics going at the same time. And it was a matter of, if you were going to be attending these protests, if you're going to be exercising that, we want to support you in that, but we also want you to mitigate. And if you're in those great groups, we are asking you to quarantine. We're fortunate we have a number of people that can work remotely, so we were able to extend that, so that was great in some ways. And then others, we just continually have to stay on the communications, stay on point of why it's important to exercise, all the safety precautions. If you're not understanding why it's for you, do it for others. I mean, it just really, we have to continue to stay on it. One thing that we also have is we utilize a lot of volunteers in direct service for our companion services, for our meal services, for our caregiver services. Most of them also went telephonic or remote. Our meals did not, but we did close our bistros or the congregate dining and just went curbside. And then our volunteers who deliver meals, they do a knock and drop. So they're mask wearing, glove wearing, hand washing, and then they actually leave meals on the door handle. And then they have to knock and walk away and make sure that someone comes to the door. So there's still the safety check, but there's no direct contact. Some of our companions, we found out, and this was lovely because they turn in time cards, they were continuing to visit people after we directed them to have no direct contact. And so very careful communications and education and ongoing. And it's been very difficult for them to to not have that direct contact, that social isolation that the volunteer is experiencing as well as the client. So it's daily. We get phone calls daily. When can I go back? When can we do this? And we just have to continue with the education, providing a PPE where necessary, where it's appropriate. We don't really have anyone doing direct contact with a very, very few exceptions. So.
It's a lot of people to put your arms around, and you know, provide education and sort of keep track of, along with all the people that you're serving.
Another thing that our organization is doing is that we've got multiple trackers, and we have a COVID response team that's made up of all lines of service, representation from all lines of service, and our full cabinet. And so we document and keep track of all exposures, all positive tests for clients, volunteers, and for staff. And so, and then there's a myriad of processes that go behind all different levels of exposure.
Do you provide some sort of data back out to your volunteers, employees, and or the people who you are serving, sort of, you know, showing what's happening within your system based on all that data?
More so, we're doing more so with our employees, because we found that they were not aware of the significance of the frequency. And so, and we've had a number of deaths. And so also helping their peers manage when we've lost clients due to COVID deaths as well. So we haven't exposed that to the volunteers, but that's a good idea for us. I think that would maybe help frame up why we're being so protective. I love the people are saying, you're being so conservative and cautious. And I'm like, no, we're just being mindful and protective. So it's even the language that we use.
Roxanne, would you be willing to sort of share a sample of the data, or sort of how you share that with your staff with Superior Health?
Yeah, I'll see if I can just get the tracker piece so that we don't have any of the identifiable information, but we've got graphs, and we have a graph that shows how things are going, and then we have pie charts for all the different areas of where the exposure is occurring.
This is excellent information, and something that at least I know I haven't thought about it's sort of like your own little CDC and or Department of Public Health, you know, sending all that out. Thank you. Appreciate to hear those details. Anyone have some questions of Roxanne? Let's move on to the next slide, please, Jessica. And again, it doesn't mean we have to lose track of the other questions. So this is kind of a tough one. Families don't work for you, but they obviously are connected to your staff. And one of the thoughts I've had over time is, you know, what do you do when you see possibly in your community, especially if you're in small communities, it's much easier to see this than in large communities. But what do you do when you see someone possibly breaking your policies, perhaps participating in some activities that you know could be detrimental to your work and possibly cause exposure, but the staff member isn't sharing with you that they went to some big, you know, event in your community? How do you address that when it's hearsay, or you yourself might see the pictures on Facebook? I mean, there's a variety of ways to find things out, and living in rural America, I know if you live in rural America, you know how that goes. So anyone have any experiences with that?
I don't have any experience, but I think the thing to remember as leaders within our organization is that it's very important to have critical conversations And, you know, if you put that in the forefront of your mind, this is just a critical conversation.
Mm-hmm.
It helps to remind us that, you know, maybe they won't be offended or upset. It's not an invasion of privacy. Again, it's for the wealth and health and well-being of the communities in which we serve. And there's no issue really with going to some of those things with your family. It's just if you see that they weren't following guidelines, that does bring up concern. So you just have to address it with concern, and be mindful of their privacy too, because yes, that, you know, we still can't cross that line as employers. So it's a nice balance of just treating it the right way, approaching it the right way. Don't make people feel threatened or feel like they're being monitored by Big Brother. Just address it as a critical conversation. And, you know, we used to call them care communications, or, you know, there's just ways to say, hey, we want to make sure that everybody's remaining safe. You can address the whole office. You know, there are ways to get the message out there. Hey, just a reminder, I know there were a lot of activities this weekend, or you've been vacationing with your families again. We just encourage you and your families to remain safe. And if you think you may have stepped out of those borders, can you just let us know so that we can take the additional precautions needed?
Excellent. I really like that, Sarah. You know, it's people do make mistakes, and it's good psychological safety within a culture. If a staff member can come in and admit to something that didn't go well or in the right way and goes against policy, it makes for a very healthy organization. I very much encourage all of you to take a look at what does psychological safety in the workplace means. It's a simple Google, and you'll find a lot of resources. Let's move on to talk a little bit about the, are you providing any assistance to support staff members with virtual school? As we all know, this is a big decision in every home in America that has children that are of school age. And they are making that decision on whether or not it is safe enough for their child to go to school, and or perhaps the school's made that decision for them by simply making it virtual school. If you have children and you've already participated in being their tutor, their teacher at home, this is definitely something that is really stressing out your staff. Anyone have some things that they've done in their community, within their workplace, to assist staff members with children who have to provide for their children's schooling as well?
I can share one idea, or one thing that we've implemented or did implement and we're looking at re-implementing now this fall is staggered scheduling, so that parents are free to actually attend to the kids, especially the younger ones that really need the attention and need a little bit more supervision and direction. So if they have someone, if we need to make sure that their clients are covered during a certain block of time, we try to adjust that per the group. We are fortunate because we do have people that don't have kids in school who can cover during those times. And we've got school districts that are looking at different things. So we've got some kids that are going to be going to school for some of the days, some not. So it's some creative scheduling that we're doing in terms of making sure we have the coverage and availability of staff to ensure that we are serving, you know, individuals and families the way that we need to, but also creating and giving them permission to be able to be away and really focus with the kids, knowing that we don't know how long this will be. Some best practices are coming from this, and so just making it so that there's a nice balance. And it's worked okay. I wouldn't say it's the best, but I think in part because we went to such virtual settings so quickly before. Now we've had this summer to kind of work through some of that with our different teams and really adjust. And then there are some areas where it's just not possible, so we're still looking for solutions. So hearing from others is always very valuable. Thank you.
Thank you, Roxanne. Yeah, I would really recommend in any one of your organizations pulling together the staff that is affected and asking them, what was your biggest barrier in the spring when we had to shut down and do such a plan? You know, what were some things that you did in your home that would help others? There's a wide range of ways that you can then communicate that out to all staff via newsletters. Put a short list in their paychecks. Put up on bulletin boards for staff ideas of how to manage this at home. Any support that you can give your staff at this time means that they're going to come in and do a really hopefully good job, better job than they possibly would if they didn't have the support. We have Rex Conley with a raised hand.
Hi guys, just wanted to pass on because this is definitely a hot topic. I work at a small clinic in Sun Prairie, just outside of Madison, and outpatient mental health. And you know, we've got a handful of our therapists that have kids. I've got kids. We're doing completely remote for the first quarter. So it's how do you balance that work? How do you balance, you know, like for example, one of our therapists has 5 kids, and how is she going to be able to have the 5 kids in 3 different schools, etc. And what actually, one thing, and I don't know if it's happening everywhere or not, but it's something that we learned of, and we've actually brought it to the school board meetings through friends of ours that, you know, work in the district. There are groups that are, I don't remember what they call them, like, but basically there's retired teachers that are volunteering to do small sessions with kids one-on-one through, you know, through Zoom, whatever. I think there's even a few that they allow them to go into the school with, just to be able to work with them for like 2, 3, 4 hour blocks of time, because, you know, it's really difficult for, you know, I mean, truthfully, for any of us to do our kids' homework these days. It's a little different than what we're used to, I guess, but those are some beneficial things that hopefully, I'm just putting that out there because I think, you know, if other places do this that are in these same circumstances, it might be helpful. So thank you.
Thank you, Rex. That's really helpful. I mean, this is on the minds of so many people. And again, it's on the minds of the leadership as well, because if they don't have children in school, they know that their staff is. So it's truly something of a difficult situation for everywhere, just everywhere. Anyone else have some best practices to share and how they've supported their staff, or questions they want to put out to the group? Jessica, let's move on to our slide that has the resources listed. So as you see on this slide, and these can be put in our chat as well, but these are some resource links that we've put together that may be of help to your organization. If you have additional resource links that you think would be of help to others, please feel free to send them in to Superior Health. We would appreciate it because then we can share it widely with others. And again, as always, we want to continue doing this. As I mentioned, we will not be having a session next Thursday the 20th, but we will again convene on August 27th, the following Thursday. And then we will move on to, in September, having one session. We continue to work on topics for you, and but we still want to continue to hear from you what it is that you would like to hear going forward. I'd also like to mention this is a great example of our chats here that we've been having of what could be an affinity group. So you can see how it's a time during the week where we gather, and there's opportunities to share, as well as there will be opportunities to have a champion on the call as well to guide us. So it's something to think about. If you haven't already joined us, we hope that you will sign up. Go out to Superior Health and or call one of us. We have here listed some of our teammates who will take your direct questions and calls. If you know some of the others of us from your state, feel free to contact any of us. We're happy to share with you and help you talk through what it is that we can do together in the future. Jessica has also put in the chat the survey. We really want to hear from you, so please complete the short survey. Anything else anyone would like to share before we end this morning?
Mary, I just wanted to point out that the call on the 27th, we have a very special guest speaker that day. So that session is not going to be recorded. So we're encouraging everyone to attend in person that day if they can on the 27th, because that will be one of the few recordings that is not going to be available online afterwards. And we're going to be talking about diabetes and cardiovascular disease and how that has been impacted by COVID.
Mm-hmm. Thank you for that reminder, Jessica. All right, any lasting comments or questions before we get ready to have you take your survey and move on with the rest of the activities of your day? If not, thank you so very much for attending, and we look forward to talking with you again on August 27th.